The May meeting of the Panhandle Health District number 1. Had a good lunch. Lunch got here on time. Don't take it personal. Okay, I'd like for us to stand as we pledge allegiance to the flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. You may be seated. We'll make a moment for public comment session if there's anyone wishing to make public comment at this time. Yes, thank you. And I'm assuming this has something relative to today's agenda.
Yes, and then I was watching the meeting before, so can I address some of that as well?
That was a total separate meeting, ma'am.
Okay.
You may speak if it's something relative to the budget.
Okay. Well, I'll start, and if I'm off course, you can tell me.
Okay.
All right. Well, my name is Kara, and I just live a couple minutes away from here. And I was watching the meeting prior, and I just felt compelled to come over and at least be a voice that can give a little bit to my experience. I have 5 children, and I don't know if I've ever used your services specifically, but probably I have in a way I don't know, but I've never been in this building that I know of. I've been in the Northwest here for close to 15 years. And my guess is that you guys do a lot of good for the community. But I do have to say that watching how things were handled through COVID in regards to decisions made about masks and the vaccine, I lost confidence in what I did know about you, and you kind of moved to my naughty list. And I don't want you to be there. So I think you kind of get an idea about where I stand on all of that. As I've said, I have a lot of children. They had friends, and I watched a lot of mental harm being done. Not to my kids specifically, because we were very intentional about the truth. And I'm not minimizing that COVID wasn't very serious and people died, but I also feel like a lot of policies created harm in other ways, and that people died or were harmed that didn't need to be. So that's what I have to say about that. I would say, according to today's agenda, I see that you have discussions about legalizing marijuana and the medicinal kind, I guess, but I've not done drugs. I haven't even smoked a cigarette. I tell my kids, it's, why bother? So I don't know a lot about this industry, but I do know that when you look at Washington State or Colorado, or if you've ever watched Rocky Mountain Heist, that you see the harm that comes in on the back end when that kind of thing is legalized. And I would say it is not worth even, and you can discuss it, but it is not worth entertaining the idea of legalizing that. People are coming to Idaho in droves to get away from the different policies in these blue states. So that is what I have to say on that. And then I'm very curious what you have to say about the family planning. I'm assuming that means birth control, and obviously I'm very pro-life, so I will hopefully be able to stay for that part of the meeting. Thank you for the work that you do, and please consider those thoughts. Thank you.
Okay. And as you might be aware, that we don't respond at this point to anything someone says. Yes.
Hi, thank you for allowing me to make public comment today. My name is Sandy, and I live here in Hayden. And I just want to thank you too for the work you do for the families. I'd like to address transparency about the agendas not having attachments. Like today, you're going to be talking about resolutions and contracts, and also the budget was earlier. Those attachments are not included routinely in your agendas as they used to be. A couple of years ago they were, but now they're not. So when I come here and you guys are going to be talking about cannabis and family X planning and all these things, I don't know, and also the budget. I couldn't look at that ahead of time to see what's going on. So I would just ask that you readdress your policies about what you put on your website. I would also like more information about contact, like how to contact you. I know it's in the agenda, an address to write to, but it's not on the website. How to write to you or how to ask for information requests. All of that takes a lot of searching, and the general public doesn't know what to do. I would also like information about the commissioners who are behind the different trustees. So that would be something else on your website. I'd like to know the more in depth who's behind Panhandle Health so that people can see the organization of it. I would like to address some of the statements made in the previous meeting. I was here for the budget meeting. I don't agree with some of the statements made about the vaccines not being pressured on children. I watched as children at Dalton Elementary were going to get vaccinations with the National Guard present. And I feel like that was undue pressure on children, peer pressure to get vaccines done. And also with the mask mandates, I don't agree that that was handled well. I feel like it was against the will of the people. People were standing outside saying, please don't put a mask mandate on us. And then it was forced on us for 3 more months, over and over again. So without knowing all of what you're going to talk about today, not having items from the agenda, I would like to say I'm opposed to the legalization of cannabis. And I would like to know more about your family planning program. And but thank you for the other work you do, for the way you provide for families and children. And okay, thank you very much for allowing me to comment today. I'd just like to add to that disclaimer, I speak for myself and not for any other organization. It's me alone as a citizen. Thank you.
Anyone else here for the public comment session? Seeing no other, we will close the public comment session and move on with our agenda. As you well know, this will be an action item. I would like to just preface before we vote the comment that you're aware that the whole idea of a consent agenda is a way in which a meeting can be usually abbreviated, and information you have in your packet before the actual meeting. So first off, I will always give you the opportunity to pull any item from the consent agenda if you want to ask questions or have further details on the item. So first off, on the consent agenda is the minutes from April 27. Not asking for a vote now until we get through the consent agenda, but any comments on the actual minutes, any corrections or any comments about the minutes? Okay. Let's go on then to the divisional reports. I'd just like to say, I realize that maybe time doesn't allow us to have all of the contributors in the consent agenda divisional report section to give verbal comment. But sometimes I read these reports and I would sure like to hear more detail than what I see in the reports. But I really appreciate these divisional reports. I look at these reports and quite often I will go to Mr. Duffy and say, okay, this person who reported on the divisional section I would like to invite them to our next meeting to have a time when they can speak more to what they do in their work. And I am going to pursue that in meetings to come. Don't be surprised if some of you folks who wrote a paragraph or two in the divisional report section, if you aren't asked to give more details at our next meeting. But, okay, the divisional reports. Anybody have any questions or comments on the divisional reports? If not, the contracts. Now you understand that these contracts have probably already been signed by our director. But if we felt strongly on any of these contracts, I don't know how this would finally turn out, but we could deny his signature on any given contract. I don't know that that's ever happened, but we have the authority to do that. All right. So are there any comments on any of these contracts? And in your folder, you have the listing of these contracts and the amount of money and the details. And there was someone asked about these contracts, and I'm sure we can get you a summary of these contracts.
Page 13.
Okay, Glenn, did you want to pull anything from?
No, just a comment, HC 340700, Family Planning Title 10, the amount is $183,810. And the summary of the contract says Title 10 provides equitable access to reproductive health care to reduce the number of unintended pregnancies. And that's pretty much all it says. So the individual that was kind of questioned on what it is, provides individuals with access to avoid, unwanted pregnancies.
Correct.
So,
Yes, Mr. Chairman. So Title 10 is a program that's been here at the Health District for many, many, many years. It is a federal program. It passes through the state that supports access to reproductive health care services. What that means is uninsured patients, often uninsured or underinsured patients, come here for annual exams, pap smears, established care with a provider. They are prescribed birth control. That could be IUDs, oral contraceptives, whatever that is, but it is for the prevention of unintended pregnancies. There is a sliding fee scale on that. So patients who are uninsured, underinsured, that is a sliding fee scale up to 100% of the total cost of their services to 250% of the poverty level. So a lot of people qualify for that program that would have a hard time covering the cost of health services at another clinic. That funding has reduced by $32,000 this year. That was over $200,000 last year. So the contract has gone down a little bit since last year. This year it is the $183,810. So that is kind of in a nutshell, and I'm happy to follow up if there are additional questions.
and I just want to note that the health district also provides new mother training, which is very important for single moms or others who it's their first time being a mother. And I think that's an important public service as well, to give them the tools they need to be a successful mother and to care for their child.
I could not agree more. I don't hit on that because those are within health promotion, so those are under Kim's divisions. WIC is also under her division, but there are a lot of services that the health district provides to new mothers, even, I believe, up to the end of the second year.
Mr. Chairman, yes. Yes, up to the second year when baby turns 2 for our Nurse Family Partnership Program. Yes,
And you manage the WIC
correct.
program also.
Yes,
Women and infants.
women, infants, and children. And that provides supplemental nutrition. Well, actually, we do provide food. It's not really vouchers anymore. We have the e-card, but they are able to go get fresh fruits and vegetables, all healthy foods that will help in aiding their growth and development.
It's a good program.
Yes.
Thank you.
Okay,
If I could
yes,
add
Dr.
one thing,
McGuire.
Title 10 also provides access for not just women, but men regarding sexually transmitted infection.
Diseases.
And yes, and these people don't have access to healthcare because they don't have insurance or they don't have parents who will take them and find a doctor for them. So the downstream benefits are way more than just preventing an unattended pregnancy.
Have a lot of health issues that rise through.
Yeah.
Gonorrhea, et cetera. Okay.
Anything else? Thank you, Dr. McGuire. Okay, I would entertain a motion to approve the consent agenda. And keep in mind now, that includes item A, B, and C, 1, 2, 3, 4 in one motion, unless you wish to pull an item and have it discussed and not passed under this blanket motion.
Mr. Chairman, I would move that we approve the consent agenda as stated.
Thank you.
Second?
And seconded, Dr. McGlandris. Any other discussion on the motion? If not, all in favor then of approving the consent agenda as presented in your packet, indicate by saying aye.
Aye.
And opposed, no. All right, we have approved the consent agenda. Mr. Glenn Bailey is on tap. Do you have anything from your executive council trustee report position to share with us today?
Mr. Chairman, we have not had any executive
Okay.
sessions since our last meeting, so I do not have anything to report in that regard. Yeah.
Okay,
So,
so just no report. Okay. When we come to item 7 on the resolutions, this is an action item, but what we're asking for, if you so see it this way, we're simply asking for approval of this board that these resolutions be presented at the IAB coming up June 7 and 8. Is that the right dates?
7, 8, 9.
7, 8, 9. Thank you.
Was it? Oh, it's 8, 9, 10.
Yeah.
Okay.
For the IAB coming up in June.
If I could, Mr. Chairman, just
Yes.
so I'd make a motion that the board approve the presentation of these resolutions to the IAB.
Okay. So what we're doing, we're approving, when these resolutions get to the IAB, it will get there with the blessing of this board. Is there a second to his motion?
Mr. Chairman, I would second the motion and open it up for discussion.
Okay? The motion is open for discussion.
Mr. Chairman, the first,
We have accumulating medical information to support the proposition
that cannabis is associated with an increased incidence of schizophrenia, particularly in young males. If we're going to do research aimed at legalization of recreational dope, I would ask that there be a sober examination of this clinical information and not just do the woke, politically correct action and say, oh, it's good. So I'm always in support of research as long as it's honest. Sadly, we have a deficit of honest research in this country.
If I could comment, my understanding of research discussed in this realm is population-based research. There are states who have legalized cannabis, and the initial reports on the research are terrible, as you've implied. And so my interpretation of this is that the question is, should the IAB, as a group of public health districts, support the fact that we need research to actually document what's been happening? I don't view this as any push to the state of Idaho legislature to legalize THC. It'll never happen in my life. But I feel, if I'm interpreting that correctly, can you help me with that? Has the board discussed this resolution? I know our board has, but I'm wondering if Glenn is. Sorry, I'm wondering if
The trustees of the executive council have not discussed this to any considerable extent. They're just
yeah.
kind of gone through it.
What's the origin of it then? Where is the?
Okay,
Mr. Chairman,
I'm
if I
sure.
may.
I'll be quiet.
Okay,
Yeah.
Dr. Jamison, you have the floor.
Where this came from was that every resolution has a period where we relook at it and say, oh, should we push this forward?
Right.
And when this came across last month, the data from this was 2006, 2008. And so
Right.
the reason for relooking at this was that it's just a very outdated resolution. And so, again, I'm not proposing that we change necessarily the stance on it, but that we say, hey, there's a lot we don't know. And so for us as a district or a board, a state board to say, we feel great about this, I think would be premature. But for us as a state board to say, there is no role for this, we have a strong position against this, I feel, based on the new data that has come forth, would also be problematic. And again, the medical cannabis resolution is not up for renewal for, I think it's another year or 2 years. The medical cannabis one says we oppose this. The recreational cannabis the previous one says we oppose this based on pretty outdated research. I don't disagree with you. I think that is a correct statement. So when we look at what happens to the developing brain with the use of cannabis, it's concerning. There's no question about that. And I believe I've included a bit of that in there, is that it is not okay for the developing brain. The data is overwhelming on that, as you pointed out. But where we don't have as much data is the population effects of the states that have legalized this. And so the basic premise of this was, let's update the research behind it so that our data is from 2021 and not 2008. And still be able to have that sort of discussion. But it was up this year for looking at it again. And that's how it kind of came to the forefront here.
Mr. Chairman, if I
Yes.
could just quickly review this. It has a number of whereases regarding non-medical cannabis. And final, therefore be it resolved that the Idaho Association of District Boards of Health supports adequate studies examining the population effects of the legalization of recreational cannabis. And I think we've all supported that position. And as Thomas was saying, we need to have true documentation to the best of medical knowledge, and what are the studies showing have been the effects of legalized marijuana use for recreation. And a lot of the studies I've seen have been negative towards it, so.
And so I would respectfully disagree with that in that I think there are both sides. And that's the challenge as I see it personally, is that I think there are certainly some concerning findings. And then there are others that are a bit less concerning. I mean, if you look at drug usage overall in teenagers, it's going down, right? But unfortunately, the potency of the drugs they're using has gone up so much that that's why overdose deaths are quite significant, right? So I think it's almost two sides to that point. And I am not overwhelmingly convinced that either side has done enough to prove that one way is the right way. I'm with Dr. McLandris. This is not something to say that we should legalize recreational cannabis in Idaho, and I agree that that's not going to happen. We may even have federal legalization before Idaho readdresses that. But I think suffice it to say that with regards to any of these things, if we come out with aggressive no stances without looking at the data that's there, then we're acting more on feeling and emotion, and I would challenge us that get into trouble when that starts to happen. And so, kind of taking a middle ground and saying, hey, you need more information on this. There are certainly drawbacks to this substance, just like there are drawbacks to alcohol, which I would argue maybe even more so, just like we've seen with opioids. But the flip side of that is perhaps time will tell, because it is a relatively new thing, this recreational legalization.
Okay. Dr. Fletcher, my guess is, it's just a guess, having been to several IAB conferences, when you are there, and I hope you are, you will be happily surprised the way a resolution like this will just get torn to shreds by those who have a position similar to yours. Is that okay to say that?
I accept that you made your statement.
But it won't, this resolution just won't and be gone. In fact, before it's over, it may be tossed out.
Mr. Chairman, I'd like to point out that fourth whereas states the potency of cannabis has continued to elevate significantly over time. The 2023 study found no association between high potency cannabis and mental health symptoms, and a possible association between high potency cannabis and cannabis use disorder. And the reference is number 2 here. So my question is, this was the 2023 study, evidently. So this must be a change to this 03 resolution. Is that true?
I'm not sure.
So are we going to be voting on this changed update, this format? I would assume so.
Yes.
You may have misunderstood the intent of what I said. I'm going to paraphrase the mission statement of the Washington Post. The mission statement of the Washington Post is democracy dies in darkness. Let me paraphrase. Darkness dies in data manipulation. So you can have studies and studies and studies, but if you have a government that is intending, whose ultimate ulterior motive is to hoodwink the population, to make it easy to control the population, then it only behooves such an agenda to get them doped up, numb their brains. So you will find those who are in favor of brain numbing measures to seek out information that supports their thesis. That's why my statement was, we need a full disclosure, uncensored, of all of the clinical information harvested, not selected information that the healthcare experts in Washington, D.C. want you to see. Let's be very clear. There is an agenda here. And if you want to blame me, Chairman, for being an outspoken person, go right ahead. But this is our country also.
I'm not aware I'm blaming you for anything.
Sir, I will leave it at that.
I just say that all of this,
We all need to take a deep breath.
So anyway, as I was saying about the fourth whereas, it appears that this would be an update, a change that may be open for discussion regarding cannabis. References number 3, cannabis legalization in the U.S. population, health impacts, health affairs, health policy brief, July 1st, 2021. So I haven't read that
This is, and
reference.
this is all different from the previous one. All of this data is newer than the 2008, when the last, it was looked at last.
I think it would be very helpful if we have a copy of the previous resolution so we can compare and contrast. Okay, so what are the items that have been updated? I don't think that's indicated on this proposed
No, it isn't.
resolution. Okay, so that would be one of my recommendations.
so, as I see where we are, we have a motion and a second to approve these 3 resolutions to go forward to the IAB.
Mr. Chairman, if I would like to review the other 2 resolutions as well.
All right. I see one way to do this. If you wish, see, this is still in a motion form. We have not voted.
Yeah, we're discussing these
You
proposed
can
resolutions.
vote this motion down if you wish, and then approve or disapprove A, B, and C one at a time if you so wish. Would that be a way that would be satisfactory? That's up to you people.
I don't think that's necessary, but I do think it's necessary that we discuss
Yeah.
the proposed resolutions before we vote altogether to approve or disapprove, or we could single them out and approve / disapprove on an individual basis. Whatever you'd like to do.
Well, it's at the pleasure of this body.
It sounds like you'd like to hold out this one resolution. It's our resolution coming from us, right? Yes, is that correct? This resolution is coming from this board to the IAB. Is that not correct? It's a change of the previous.
Correct,
Right.
and I'm a bit unclear on, so last meeting, we reviewed the previous, there was a bunch that we had reviewed the last
Yeah,
meeting.
this was,
When we review those, then because it's our board meeting, right, that we're essentially presenting it and saying, okay, we have to agree on this and this and this one. And so to your question, Dr. McLenders, I think, yes, we are saying, hey, we reviewed this and it needs to be renewed at the June meeting, but we feel like it needs to be changed.
So we would be
So the other
approving or
two,
disapproving the revised resolution.
for then presentation, correct.
The copy I have of the 1903,
that's from 2019, right?
it does not say which board has,
Yeah, from 12, right? Resolution.
Okay. So in the meantime, what you wish to do with the motion and a second that's on the table right now?
Well, I think we need to continue discussing
Okay.
these proposed changes to the resolutions before we have a motion to approve what we have here before us.
Dr. Jameson?
And Mr. Chairman, my only concern with this is that if we do not approve all three of these, then that June presentation comes quickly, and I know that we spent a lot of time discussing the licensing fees from the Idaho code. And so perhaps we should approve the two that are not this and have a discussion about that third one in and of itself.
Yeah, I can just withdraw. Agreed, I could withdraw my second, and you can withdraw the motion, and we can make a new motion reflecting the two resolutions, and then
Would it,
a motion to,
well, I think, Dr. McClanders, at this point, I think that you just need to vote no on the motion and then come back with the new motion.
I think he's right.
Yeah.
That's actually closer to Robert's rules. Yes, sir.
Okay, so the motion says that we would approve all three resolutions being forwarded on to IAB. Moved and seconded. All in favor indicate by saying yes. Did I hear any yeses?
Yes.
I'm sorry.
Yes.
This is for the, just for this board, Lolly.
I'll be disappointed, yes.
Okay, all right. All opposed indicate by saying no.
I said no.
Oh, okay, so the motion is defeated. I will entertain a new motion if you wish just to include resolutions A and B, and then we'll deal with C later. No?
I think we need to discuss each of these before we approve them. So, Mr.
Okay.
Chairman, my motion would be that item number 7, resolutions that we discuss, A, B, and C, and individually vote on
We can do
each of
that.
those.
We can sure do that.
So that'd be my motion.
All right.
Second.
All right, so this motion would be that we take each one, A, B, and C separately. All right, so we have a motion and a second, and this is not approving any of these. It's just saying that we're going to take them each separately. All in favor of this motion indicate by saying aye.
Aye.
No? Okay. Now, let's go to item A. Prevent fentanyl overdose and poisoning. Discussion. I have no motion, but I will entertain discussion. Dr.
So, before I make my remarks, let me say I'm in favor of the resolution. Let's be very clear, I'm in favor. That said, the encouraged implementation and use of tools to overcome fentanyl overdose are not without some consequence. And the consequence is unintended, by the way, totally unintended. If you have a drug out there that can potentially kill people, and you have another drug out there that is readily available, and you can even do tests, and it can protect you against an inadvertent overdose, the unintended consequence of that program is you may be increasing the use of the drug to begin with. And there's data to support what I've just said. Now, I am not so cruel-hearted as to say, no, we're going to deny young adults who are experimenting with drugs, who happen to pick up some bad junk, and they die. Remember, I started out my comments by saying I'm in favor of the resolution, but I think we need to be adults here and understand that such a program of widespread utilization of drugs that can counteract the inadvertent overdose of the opioid acts as a tool of codependency. We just need to recognize that as a fact. Now, what do we do about that? I'm not mature enough to know. I don't have the answer to that, because we have to try to save lives as we can. And I believe that. I'm not gonna say, well, you're on the edge of you're about to commit suicide. Here, can I help you? No, that's not mature behavior. But understand that programs such as this, and I said as much to Sheriff Wheeler, we have in Bonner County programs to, in fact, all of the deputies, all of the EMS, they're all carrying, the drugs that counteract a fentanyl overdose. They should do that, I get it. But it's not without some consequence that you've created a crutch that will, in a very insidious way, increase the use of those street drugs.
Go ahead.
Mr. Chairman, I agree. My question is this. There's no indication of what, is this a brand new resolution? In other words, is this 2023, so it'd be 03/whatever resolution that we're proposing, or is this just a modification of
Okay.
a existing, because I haven't seen this one before. And I'd like to know the background as to, okay, is this the first time this will be presented to the Idaho Association?
I don't know. Does any of our staff know?
I do not know, I'm sorry, I don't.
No, we don't.
Well-
If I may, I believe that the fentanyl resolution and the 1602 resolution was provided to us by the Southwest District Health.
Okay.
And I believe that they are two new resolutions on their end.
That's what I remember too. We talked about that a while back.
Yeah, so
Okay.
that's-
Because there's no indication on this resolution that it has been approved as the other ones indicate.
And that,
Well,
I'm
except for 1903 doesn't show when it was approved.
If I could, Mr. Chairman.
Yes.
Recognizing previous comments on this resolution, recognizing that totally, I would make a motion that we, as a board, approve the presentation of this resolution to the IAB.
Okay, thank you. Thank you. So we understand, we're not approving this resolution necessarily. We are approving it to be discussed.
To
at
be
the IAB.
presented.
And believe me, it will be discussed. I've been there before.
So, Mr. Chairman, if we could just quickly review the whereases and the therefores on this.
Okay, just one more. You made the motion, Dr. McLandris?
Yes.
Okay, do we have a second to the motion?
I did, I
That was your
I am
second?
in favor of the resolution.
Okay,
Yeah.
all right, we're open for discussion. Go ahead.
Okay, we probably need to approve. Did we approve the?
No,
that
No, we
motion?
haven't voted.
no, we haven't voted yet, but you can sure,
Because after we
You
vote
can-
on that, then
you're-
we can start
Yeah.
reviewing each one. So ask for a vote on that last motion.
Glenn, you're welcome to discuss the motion.
Well, that's not what I want to do. I want to proceed discussing each of these individually and approving or disapproving individually.
I think we
That
are,
was the
That's what
motion.
we're doing.
That was the motion.
All right, all right.
Did we have a vote
So
on that?
if we vote on this, we're done with it.
No, or no?
we already
Yes,
voted
we
on
are.
that motion.
And we already approved what you're
The
talking about.
discussion?
You're one vote.
I'm behind?
Yes.
Okay, I apologize, because I don't recall the vote. All right. So this resolution to support the increase of collaboration, funding, and access to life-saving tools to prevent and reduce fentanyl overdose and poison. My first comment is, that's an awful long title. Why can't we just say resolution to support the reduction of fentanyl overdose and poison?
What I could comment, Mr. Chairman, is that would be the role of the IAB. The members there would discuss and add and change to the resolution.
Yeah.
That would be
An
the,
amendment to the
yes.
resolution.
Our job is to review the resolutions, and because we're the chair of the IAB this year, right? We just need to agree that we're having them presented.
Yes.
We don't need to change them. We shouldn't change them now. It's not our resolution.
Okay.
So are you comfortable and ready to vote? All in favor, and all we're doing is approving the presentation of this resolution at the IAB. And there it will get, who knows what will happen to it. Are you ready to vote? All in favor, say aye.
Aye.
And opposed, no. All right, we have approved letter A to go forward with our blessing at the IAB. Let's move on to item B, remove food establishment license fees from Idaho code. And this had been presented a time or two. Eric has talked about this. What is your pleasure on resolution B? As far
If I could, Mr. Chairman,
yes,
we've been around the block on this for 40 years.
yes,
My understanding of this resolution is it gives us control as a district to
yes.
do our own work on this, and I'm in
Yes.
favor of that. So I would make a motion that we agree to present this resolution to the IAB.
Who knows better what it costs us to do this work than us,
In each district.
each district?
Yeah.
All right, is you moved,
To
Move
present,
this
that we
along.
present this.
Second.
all right, do we need to discuss it any further? All in favor of this motion indicate by saying aye.
Aye.
Opposed, no. And we have voted to move this on to IAB with our blessing. All right, now we're at resolution C. What is your pleasure? It says here, support research on the legalization of recreational, parentheses, non-medical cannabis. Do we wish to vote to move this on with our blessing, or do we vote not to? Dr. Fletcher,
I move that we approve it.
okay? And
To
make sure it gets duly,
Yes, sir. You read my mind.
Discussed.
It needs to get discussed. That's right.
okay. You could even put that in your motion.
Oh, you mean that it needs, but you assured me it's gonna get discussed, so I took your word for it.
That's how I predict, but,
Okay, well,
okay.
if I'm there, it will get discussed.
Oh, I'm sure. All right, all right. Did we have a second?
I'll second.
Okay, thank you. We have a motion and a second. Any other comment? Are you ready to vote on Resolution C that we send it on to IAB with our blessing? All in favor indicate by saying aye.
Aye.
Opposed, no, and is so ordered. All right. One question I failed to ask in the absence of Mr. Duffy at this meeting. Is there someone who this week was appointed as acting director? And then that would also carry on to this meeting right now. In the absence of Mr. Duffy, you would be the acting director, Kim. So just give you all kinds of warning that you'll be responsible for item 10.
Oh.
Okay, but right now, we will turn the floor over to you, Kim. Program highlights the opioid settlement funds, and then this is your responsibility and your.
Okay. Well, Mr. Chairman, members of the board, thank you so much. We today are going to just have a very high level overview of what we're doing with our opioid settlement funds. So it's a very, very big thing in the news and lots going on. So, and for those of you that don't know me, my name is Kim Young and I am the Health Services Division Administrator. So I'm going to start out by sharing with you what the funds we have received to date, and then I'm going to be pretty exact, and this is a moving target, but we have received $1,410,898.64, so right down to the penny. We have received that from the Johnson & Johnson, McKesson, Cardinal Health, and AmerisourceBergen. That was one settlement, and we have received the first 2 payments of that. We have also received the first 4 payments of the Janssen settlement. And then once we have done our budget, we actually did an average of that. So that's what we are including in our annual budget, or estimated annual budget there at the bottom. But the funds from these settlement funds will fund us up to 18 years. And then, of course, we're waiting for other settlements. There's other settlements out there that are still processing and pending. So it's definitely a moving target. So unique to each state of how they allocate, the funds actually go through the Attorney General's office, and then they then allocate them to whoever signs on to the settlements. They then allocate them to the public health districts as well as cities and counties. And cities and counties then have the option to reallocate to their local health district. So in our district, we really thank the cities of Hayden, Post Falls, and Coeur d'Alene, and also Shoshone and Bonner counties. They reallocated their funds to us, and so we thank them for their trust in us to manage those funds and to continue to do the remarkable work that we've been doing since back in 2017. And so our estimated total annual budget as of today is $760,000. And then, of course, as we see those other settlements come to light, then we'll be adjusting that.
Mr. Chairman?
Yes, question.
Kim, so
Yes.
is this the second year that we're receiving these? Because you're saying 790,000 annually?
As of right now, the funds, so we've received the first 2 payments. So in fiscal year 24, I'm sorry to get my fiscal years mixed up, but in fiscal year 24, that is what we're estimating annually. And that does include that first 4 year of Janssen, but we've took the average of that. Do you want me to go back?
Projecting on an annual basis that it will be 760,000 annually?
As of today, and then that'll depend on when other settlements come through. So we are doing it based on what we know now.
By the other settlements is what you're saying.
Right. And actually, yeah, included in that is we have a settlement that has not settled yet, and we did a projection.
forecasting that this would be a minimum annual income?
As of right now, that is our estimate.
Right now,
Yeah.
it would be increased by the other settlements. And would
Correct, if there's other
would they
settlements. Mhm.
Be over the same 18-year period, or would that be according to the settlement?
It would be according to the settlement. Yeah, each one has a little bit of a different years to them, so it's going to depend on that. Yeah, good question.
Thank you.
Okay, so these are some of the current projects that we are doing. We have, actually what we do is we operate on our four pillars of prevention, harm reduction, and then treatment and recovery. So we set goals within those areas, and then we base our projects and the needs in those areas. So under prevention and harm reduction, we have our dispose, lock, and carry program, which we promote disposing medication safely, locking up medications, and carrying naloxone in case one encounters an overdose. And then we purchase the supporting supplies for that, such as nalox boxes, overdose rescue kits, and medication disposal pouches and lock boxes that we do distribute out to organizations in the community. And then we offer opioid education and naloxone trainings. And those are to organizations where drug trends are discussed, how to recognize an overdose, what to do in that particular situation, and how to administer nasal naloxone. And then we also purchased the opioid simulation goggles for education and outreach. So much like the brain you guys saw that we do for education about the detriments of vaping and tobacco use, the opioid simulation goggles are used in education, and it actually shows what it would feel like if you were a chronic user of opioids, and then how it may affect your life negatively.
Sorry, Mr. Chair, if I can ask you another question. So these funds are being divvied up, and I'm not sure where the health districts have been designated as the source, or is it also health and welfare going to be distributing from this fund? Or is it just health districts?
Good question. So do you mean as far as them receiving funds, or?
Managing the distribution of these funds.
Mhm.
The funds, are they going to each county based on population? Or how is that distribution being determined?
Thank you. Good question. I don't have all the percentages in front of me at the moment, but the Attorney General's office set forth percentages that do go out to the different, the health districts get a certain portion, and then cities and counties get a different portion. And I believe it's based on population, but I'd have to
Okay, so
research
it's
that.
not the health district that's determining how much of the funds is being distributed to each county.
Correct. It's,
It's
yeah,
the Attorney General's office.
correct.
For the settlement, okay. And these Narcan and naloxone,
Mhm.
is that being funded through these funds?
Yes, through settlement funds. Yes, we can purchase them.
So
Mhm.
that's helping considerably, I'm sure.
Yes,
Thank you.
absolutely. Yep. Thank you. And the last thing we have on this page here is the Substance Use Summit. That is June 15th. And that is a one-day summit in Post Falls that we have, our team, I should say, has been really good at planning these couple years now. And this is a summit when healthcare professionals, clinicians, law enforcement, first responders, and community experts, they will come together to learn about best practices and drug trends. They can also earn some CMEs and also post and EMT credits for that as well. And so other projects that we have funded is under our prevention pillar, we have Be the One, and that's a primary prevention program that we have set for schools. The goal of the program is to bring evidence-based strategies and trainings for students, school professionals, and parents to help prevent the development of substance use disorder. And then in our treatment and recovery, as you may have remembered from a few boards back, we had Tegan that came and talked about the ILED, or the Idaho Law Enforcement Diversion. So that's another program So instead of being charged with a felony possession of a controlled substance, then the eligible ILED participant are connected to substance use treatment and recovery sources. And it's important to note that the participants must actively participate for 12 months to be deemed successful and have charges dismissed, specific charges.
Mr. Chairman?
Yeah, Dr. Jameson, I'm sorry.
Kim, for the ALED program, is it all controlled substances or just only opioids like fentanyl?
There are specific, but I'm going to actually, if I may, and I don't know if you know the answer, but I do have McKenna Hunziker here. She is our coordinator for the opioid settlement funds. And so if she might be able to help, do you want to come up and if you have the answer to that?
Mr. Chairman, may I address Dr. Jameson?
Absolutely.
It is not just opioids, it's methamphetamines, cocaine. We haven't seen marijuana specifically in our program, but it would be up for discussion based off the encounter with the individual.
Thank you, McKenna. Yeah, thank you. Okay. And then last, we have some applications for funding. So we actually felt it was important that our community had the opportunity to apply for funds to work on planned projects that help meet the needs in their community and what they think would make a big impact that relate to opioid abatement. So we had our first round of applications, and I'm happy to say that we are going to be providing $77,300 for projects that will be completed between May 1st, 2023 through April 30th of 2024. We anticipate that we'll be able to supply $50,000 per fiscal year as of right now, based on the budget we have, depending on what other funding comes available or other settlements, we'll readjust that. But $50,000 per fiscal year as of right now that we could provide for funding. Our next call for applications we anticipate would be for spring of 2024. And you can see the list right there of who we've approved. So we're excited. So with that, thank you very much for that high level overview. And yes, questions?
First, I want to go back to Dr. Jameson, make sure you had your questions answered adequately. You have these resource people here right here, so go for it. Did you have any other comments?
Well, I just have one comment that I took my teen and my preteen, Lord bless them, to the fentanyl at the Coeur d'Alene High School that you guys did, and it was phenomenal. So, I mean, it was so well done. It's such a wonderful thing to offer to the community. So thank you for that. But my questions were answered. Thank you.
Thank
Any
you.
other comment or question while we have these ladies here? Yes, go ahead.
My question is, I know our court system used to have an 18-month alcohol and drug cessation clinic. Is that been supplanted by the ILED program?
Do you know the answer to that? Okay. Mr. Chairman?
Mr. Chairman, may I? Are you referring to their treatment court program?
Yes.
Yes, so that is separate from us. That is once they've already had a criminal contact and are in the criminal justice system. This is prior, so this is pre-arrest diversion.
Okay.
Mhm.
Thanks for the clarification.
Anything else? Yes.
I'm gonna really get myself in trouble. I'm gonna build upon the comments I made earlier regarding that resolution. And the upshot of what I'm gonna say is beware of unintended consequences. So naloxone reverses the lethal effects of an overdose of an opiate. Congratulations, we just saved someone's life. So what we have done is facilitate a dissociation between a behavior and consequences of said behavior. We can now jump out of an airplane without consequence of falling to the ground and dying, because you'll have a parachute. Now, will that program stop jumping out of airplanes? I don't know the answer, but don't assume there'll be less jumping. Now, let me now make the comment that's really going to get everyone unhappy in this room. In the 1950s, the birth control pill was created. I'm old enough to actually remember this. And what unintended consequence did the dissociation of sexual intercourse from the biological phenomenon of pregnancy have on human society?
Increased promiscuity.
Right. It turned the sex act into recreation. What long-term societal consequences accrue from that behavior? Ladies and gentlemen, we're living it, and maybe historians 500 years from now will give us feedback as to whether that was a good idea or a bad idea. But just because you've created a drug that can dissociate behavior from biological consequence doesn't mean that it's a good idea. Just think about that. Thank you, Chairman.
Anyone else? If not, thank you, ladies.
Thank you very much.
You have stimulated some thinking. Sure.
Always.
Christine, you've been patiently waiting for your opportunity. This is it.
Thank you, Mr. Chairman. I anticipate this will be quick. Our fiscal story has not changed significantly since our reporting in March and in April. The first thing that we will look at is our cash. And we're reporting as of April 30th, 10 months into our fiscal year. Our ending cash as of April was $5,012,000. Before we take into board committed funds and restricted funds, that represented 5 months in reserves. Once we adjust for those board committed funds of $681,000 and the program restricted funds of $1.5 million, we have 2.81 months in reserves. If there are no questions on the cash balances, months in reserves, I'll move on to the budget to actual. No questions, budget to actual. High level, again, our story hasn't changed over the last couple of months. We remain under budget in environmental by 289, health services, home health, as you know, we closed that. It's showing as under budget 690. Clinical services under budget by 121.8. And our other categories, general services under budget by 174.16,643, and other fees. Our grants over budget by 1.6. Interest, as I've mentioned, that was a hard one to budget for as we went into fiscal year 23, over budget by 86,000. And our other categories, rent, other donations, and miscellaneous, are under budget by approximately $119,000. Our total revenue, and this takes into account our county funding, our total revenue is over budget by $935,000. We remain under budget in personnel expenditures by $601,600, under budget in total operating expense by $352,000, also under budget in capital expenditures by $77,400, over budget in trustee benefit payments. This is the category that I've previously mentioned, that the primary reason for this is we had an opportunity to pay for night stay of treatment in the HRSA fund. That represents a large amount of that. And then also for some of the settlement funds that we've received in fiscal year '23, there will be some pass-through dollars included in the $100,000. So in total, we have an excess of 1.7 million. Once we take into account our change in accounts receivable, because we are cash basis, we adjust for the beginning cash balance for the year. It brings us back to our ending cash balance of $5,012,000. Are there any questions? No questions? This concludes my report, Mr. Chairman.
Thank you. Any comments at all for Christine?
We always appreciate your clarity about that.
Thank you.
Yeah.
Okay, well, very good. I sure like the way we're coming along on wiping out our debt. We're going to get through that whole loan without paying any interest, aren't we?
Well, for the last several years, yes.
Yes.
Yes, for the last several years.
Yes. Yes, indeed. So, I'm going to be free to tell us if you simply don't know. But if you wish to comment anything or from any of your staff about the June IAB, Jessica may have some comments, but what can you share with us? Registrations or anything else?
Perfect. I know that I can share that it is June 8th through 10th at the Hampton Inn.
Okay.
And I will actually ask if Jessica has some updated numbers maybe.
We are currently sitting at about 38 RSVPs. If you haven't done so here, I think I only have one or two from our board that has actually RSVP. So if you haven't, just reach out to me. I can do it for you. Just let me know that you're going to be there so I can get a head count. And then that's the only update that I have. I do have the agenda, so if anyone has any questions about the agenda, I can try to navigate it.
See, we're a little bit on new territory. See, we're trying to get IAB going again. And I know that some say it's costly, yes, but I think it's also important. There's something about the continuity of getting all 7 boards together and discussing some of these issues, and just the camaraderie of knowing who the members are from around the state. All right? And yes, sir, it'd sure be nice if you were there.
Yeah.
Except because you see, our own Glenn Bailey is the chairman of these discussions that are coming up.
So I'm supposed to be
Yes.
there. I'll take time off.
All right. Okay. And I don't know that there's anything to be said right now as far as board elections.
I don't have any information on that
Yeah,
at this
and
time.
I don't either. There's a few things in the wind, but not to come forward at this meeting at this time. Okay? I want to thank you for your patience and the professionalism that has been displayed among our folks through 11 o'clock up to or even right now. I I am so pleased with you people. I can hardly contain myself when I try to say that. I see a few meetings, I see city council meetings, I see college board meetings that just seems like a disaster sometimes. But I can always depend on this board. You notice how often I have to use a gavel to bring you people back to order? I don't even know where it is. They showed me one time. But we don't have to use it for this board. I don't know of any other business to come before this board at this time. Anyone else have anything to say? Thank you for being here. And if you're not sure when the IAB is, ask him. And our next regularly scheduled meeting is July 25. If I don't see you before, I hope to see you there. I want to thank Jessica for learning how to be our recording secretary. If you see her minutes, she's very thorough. Very thorough. Thank you.
Good job.
We are adjourned. Wally, nice to have you here.